Well, let's imagine better health with CHI Health. We're inching closer to the holiday season and some of our favorite foods.
But not everybody can say they're looking forward to it, especially if you have GERD or acid reflux. Our guests are regional leaders in gastroesophageal disorders.
Dr. Samit Mittal is the director of the Esophageal Center, and Carrie Bertolotti is a CHI Health nurse practitioner. Good morning to both
Hi,
of
Doctor.
you.
Carrie, it's great to see you.
And this is one of those issues that affects a lot of people. It's GERD, acid reflux, heartburn. It's kind of a big deal, and it's fairly common. How common is it?
About 30 to 40% of people complain of symptoms of reflux disease at least once a month, and most of them more than twice a week. So
What
it's
are
very
those symptoms? I hate to interrupt you, but you mentioned
most common symptoms are heartburn, a feeling of a burning sensation in the chest, so the food coming up after eating, most commonly at night. People may wake up at night coughing, choking, and a lot of other variety of symptoms, but these are the most common ones.
Yeah, what causes this? I get some of those symptoms on occasion, but what's the cause?
Normally, the stomach always has a pressure that's higher than the esophagus, and to prevent the liquid coming back from the stomach to the esophagus, there is a sphincter. If the sphincter is not working very well, then the reflux would happen. And usually the contents in the stomach are acidic, so the liquid coming up is acidic, and that causes the symptoms of burning in the esophagus, because esophagus feels the burn just like your skin would.
And the sphincter right there where it says LES, that's
Yes,
kind of
that's
what holds
where, that's what it's supposed to be. If it's not working very well, then it would allow the contents to come up.
acid reflux and GERD are similar but not the same, right?
Acid reflux is more of a layman's term because the contents coming up are usually acidic unless they are changed by medications. Gastroesophageal reflux, or GERD, is the correct scientific term to portray that stuff is coming up from the stomach into the esophagus, causing a disease. Acid reflux disease merely makes it into a pH-based disease, which is not the correct way to term the disease. But they're used interchangeably, though not accurately.
Yeah, and a lot of people, they depend on, sometimes it's a purple pill, sometimes it's a capsule to take care of a lot of these issues, right?
Yeah.
Is that just masking the symptoms, or how does that affect people?
So medications that decrease the acidity of the stomach, such as the purple pill and or the other proton pump inhibitor class or the H2 blockers, they're very good at changing the acidity of the liquid. So the pH from 2 normally goes to a pH of 5 or 6. So even when the liquid comes up, which it continues to, it doesn't burn as much. Imagine basically some acid falling on your skin with a pH of 2 versus a pH of 6. It doesn't hurt as much. So they do a good job at taking care of the symptoms, but the reflux continues and it's just masking a symptom.
Are there any long-term effects of taking those pills? Like, as you said, you're masking it. Is there any risk?
Well, I
in
imagine
doing
there's
that
a reason
for
there's acid in
years?
your stomach. If you're diluting that acid, it has some sort of impact.
So some of the risk of taking the medication long terms could be in terms of the decreased absorption of the nutrients. So you have less absorption of calcium and magnesium. Some of the other side effects, in my opinion, are the persons don't know that they have reflux anymore because it's masking a symptom, and they may continue their refluxogenic habits, overeating, eating late at night, and continue the disease and possibly cause more damage to the esophagus over long run. And so there's also increased incidence of pneumonias in people who take these suppression medications, increased incidence of some what is called C. diff colitis in people who take these medications long term. So as we use them longer and longer, we are coming up with more and more side effects of these medications. And yes, normally the environment in the stomach is sterile. But when you take a PPI or acid suppression, it has bacteria and bugs that grow in it, so it's more dangerous.
I want to get Carrie into the conversation a little bit here. When someone comes to CHI as a patient, there are certain things that they will experience, right? Would you take us through the process and what they should expect if they're a new patient?
Sure. You know, we tend to find a lot of people, most of the patients that come to see us have had symptoms for many, many years. And sometimes they've been to their primary care physician and had some of those symptoms treated, but not always well treated. So they may have had previous endoscopies, previous testing, they may have seen a gastroenterologist, and a lot of people have you know, felt for many years there's really nothing that can be done for them. So we have a really fantastic team at Creighton, and we're able to pull together the records for those patients, what's previously been done, and then we have a clinic staff who is able to review the records that have already been done, and then we pull together what is needed based on the future for their consultation in the clinic. So by the time you make it to the clinic, there's already a fair amount of work that's been done for you.
We're going to take a look at a graphic here in a second, but doctor, there are a number of procedures, and there's things you can do about this, but changing your lifestyle is one of them, right?
Yes. So lifestyle is probably the first step if you're having symptoms of reflux disease, and that is not eating late at night, not overeating, and keeping the head of the bed up. And most importantly, which is probably the hardest to do, is drop about 10 to 20 pounds, which we all
Why
would
does that
benefit.
have an impact, losing weight?
So as we gain weight, the pressure inside the stomach or the abdomen increases, and that increases the chance of reflux to happen.
Makes sense.
And that's why it helps to drop 10 to 20 pounds.
You
You
can-
talked the medications.
And medications. Medications, I think, should be used more on as-needed basis. It just should not be taken that it is curing a disease, it is suppressing a symptom, and it should be more like using a crutch rather than a replacement.
Short term,
Short
not years
Yeah.
worth of treatment. Get a screening. Specifically, what would that entail?
An endoscopy is a great place to start. That allows us to determine if there's any sort of anatomical problem. It can tell us if there's something wrong with your esophagus or with your stomach. And then there are other tests that can be done at the same time as the endoscopy if you wish.
Taking an active role. I'm sure you'd like to see your patients do this, right? In general,
Yes.
why does it matter when it comes to GERD, acid reflux, and heartburn?
Well, the biggest thing is that a lot of people undermine that how severe the problems can be with reflux disease. We see a fair number of people who for years have thought or presumed that their heartburn or the reflux is treated because they don't have heartburn on medications, while they don't attribute the symptoms of waking up at night coughing and choking, asthma, progressive lung disease to the reflux, which is probably the most likely cause of it.
And there's other procedures that can be done, and people who are experiencing reflux should learn about those, talk to their practitioners, contact you guys.
Yeah, well, I think it's important to note that you offer more procedures than anybody else in our region. So if you're looking for options, we encourage you to call 402-717-4837. But the big takeaway here is, as we head into this holiday that's filled with family and our favorite foods, you don't have to just sort of sit and not enjoy it. You do have some options here, and you can learn more about them online at chihealth.com/esophageal-center.
Yeah, and if you're one of those people that just pops Rolade after Rolade, maybe
Cut it
something you want to
out.
look into, huh?
Take care of yourself.
Doctor, thanks for
Thank
coming in.
you.
Thank you.
It's
Thank
nice
you.